lose heart TTSH, the Prime Minister offering words of support to hospital staff who've been fighting COVID and discrimination. On the eve of Phase 2, a public health expert tells us it may be the first of many temporary blips. And from October 1st, Singapore passports will be valid for 10 years for those aged 16 and above. It's 5:30 p.m. here in Singapore. You're watching The Big Story. I'm coming to you live from the Straits Times newsroom. You can subscribe to the Straits Times channel so you never miss a single episode. 4 new COVID-19 cases in the community were among the 25 infections confirmed today. The remaining 21 were imported. Now among them, 15 are Singaporeans or permanent residents. More details will be released tonight. Meanwhile, about 1,500 students, staff and external vendors at Edgefield Secondary School have tested negative for COVID-19. The school, which had shifted to full home-based learning this past week, will resume physical lessons next Monday, May the 10th. Prime Minister Lee Hsien Loong said it is distressing to see the discrimination that Tan Tock Seng Hospital staff have faced. TTSH staff have been at the front lines of not only the battle against COVID-19, but also against discrimination, including being turned away by ride-hailing services or being shunned in public. In a Facebook post today, Prime Minister Lee said that while people are understandably fearful, the discrimination is no less distressing to see. PM Lee said we cannot let setbacks divide us or wear us down, because if we lose our unity, the virus has won. Don't lose heart, TTSH. Singapore is with you. Meanwhile, in an advisory from the authorities, businesses should not use people's exposure alert information from the Trace Together app to grant or deny access to premises. This follows reports of business owners turning away visitors and customers whose Trace Together records showed they've been in close proximity with COVID-19 cases. Though people may receive alerts to monitor their health for 14 days after being in the general vicinity of a positive case, authorities said the risk is very small. This as they may not have interacted with the case within close proximity, especially in big spaces like malls. They added that those who are deemed close contacts would have already received a quarantine order. In a few hours' time, Singapore will officially return to Phase 2, when social gatherings will once again be limited to 5 people. The move comes ahead of what would have been an extremely busy few days, this being the last weekend before Hari Raya and Mother's Day on Sunday. Joining me now is Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at the National University of Singapore. Welcome back, Professor. Looking at the numbers over the last few days, community cases have come back down to the single digits after the spike in cases involving the Tan Tock Seng Hospital cluster. Prof, what do you make of this as we go back to Phase 2?
Thank you very much for having me back. So it is a good sign that the numbers, especially those linked to the 2 largest clusters at TTSH and ICA, appear to be coming under control. There are 4 community cases today, but we will need to see whether any of these cases are linked to the active clusters or unlinked. As always, unlinked community cases are worrying, since it means that something is happening within the community and we don't know where or how these people are being infected. But given that some of these active clusters are driven by highly transmissible coronavirus variants, it is certainly better to play it safe.
Right. Prof, do you see us returning to Phase 2 as a significant setback in Singapore's reopening efforts?
So clearly this isn't something that we hope for, having to move back to Phase 2. And this is actually the worst outbreak we have seen in Singapore since September or August of last year. But we have overall been able to maintain extremely good control over the COVID-19 situation in Singapore, to the point that most of the social and economic activities have been allowed to resume to a large extent. And precisely because this control over the situation is very hard-earned through a lot of sacrifices, sweat and tears from the general public, and also the people directly involved in the COVID situation, we are not taking things for granted. And if we get a sense that the situation doesn't look right, we will tighten up a bit. So presently, the signs appear to suggest that this is a temporary blip, and we need to put in place a move back to phase 2 to resolutely break all chains of transmission in the community. I think the reality is that we will all have to be mentally prepared that over the next year or even longer, this will be what we in Singapore, as well as many other countries worldwide, will have to do to dial up and dial down our measures, especially border control measures, as we experiment with relaxing more and more of our restrictions.
The latest numbers for Singapore's COVID-19 vaccination program. According to the Health Sciences Authority, serious reactions to vaccinations are very rare, affecting 4 in 100,000 people here. Between December 30th and April 18th, some 2.2 million doses of the Pfizer and Moderna vaccines have been administered. There have been about 2,800 cases of suspected adverse reactions, of which around 70% involved people who were younger than 60 years old. Among the cases, 95 were serious adverse effects, which include 20 cases of anaphylaxis and 25 cases of Bell's palsy. Prof, that's a lot of information to digest. Were any of the results surprising for you, say comparing the findings with other countries?
So I was actually assured that what we have seen in Singapore in terms of known adverse events, whether it is mild or serious, are very much in line with what other countries have been reporting. So our rate of suspected serious events, as you mentioned, is about 4 in every 100,000 doses administered. And one of the most worrying serious events that you mentioned is anaphylaxis, which can of course be life-threatening if not managed early. And we have seen that the figure for this is actually very, very low as well. It's about 1.4 events out of every 100,000 doses. And this figure is in line with what other countries have been reporting, which is between 0.5 to 2 events out of every 100,000. So more importantly is also that we haven't seen any evidence of unknown adverse events, such as the blood clots which have been reported for other vaccines that are not used in Singapore. And in other words, the vaccines that Singapore uses from Pfizer, from Moderna, we do not actually see any evidence that they cause any previously unknown adverse events. And this is aligned with what we have seen internationally as well. And for example, in the United States alone, there have been more than 240 million doses of Pfizer and Moderna vaccines being administered as of yesterday, and there have not been any links between these vaccines with previously unknown adverse events. So what was shared yesterday was very assuring because the COVID-19 vaccines we have in Singapore remain safe for people to use, despite the fact that they will cause known mild side effects such as rash, fevers, aches and pains, and even the more serious side effects that we know about, they are known and they are actually very rare.
Given what you've just mentioned, should it then come as a reassurance to people who are still hesitant about getting vaccinated?
Yes, indeed, because I think this is where we need to separate out the mild side effects that we talk about, the rashes, dizziness, fevers, aches and pains, some itchiness, which is what accounted for those 2,800 reported adverse events. The numbers look a lot, but those are very mild and known side effects. They are not life-threatening, and the symptoms actually go away after a while. And we need to separate those from the serious adverse events, which is what you talk about, anaphylaxis and other more severe allergic reactions. Those are very rare. You mentioned 4 in 100,000. And just to highlight also that there are many safety checks and layers of safety nets built into vaccination protocols worldwide, especially the ones that we have in Singapore. So for example, the first safety check is that prior to the vaccination, if you show up at the vaccination center, there is always a pre-vaccination screening where you will be asked whether you have previously experienced any allergic reaction to food, medication, or other vaccines. And if so, they will evaluate whether you should proceed to be vaccinated. Now, just before the actual vaccination itself, before the nurse sticks the needle into you, there will be another verbal check to make sure that you have no prior allergies to food, medication, and vaccines. So these 2 layers of screening will already help to pick up those people who previously know about their history of allergies. But the question is, what happens to those that may not know about their allergies or may have never experienced it or perhaps just have forgotten about their allergy history? And this is really where the post-vaccination observation becomes important. So after a person receives the jab, have been vaccinated, they have to remain in the observation zone for 30 minutes. And this 30 minutes, you will be monitored. And if you experience any problems, any uneasiness or discomfort, you can actually sound out. And this 30 minutes is already double what is internationally being recommended, which is 15 minutes. And most of the severe reactions that we have talked about, they tend to manifest within minutes after receiving the vaccination. And that's where they can be identified during this 30-minute observation period. And of course, the last layer of the safety net is how every single vaccination center in Singapore for COVID-19 vaccines is equipped with the necessary medical equipment and the trained medical personnel to handle precisely the kind of medical emergencies that will come about because of this vaccination. And all of these different layers of safety nets come together to ensure that people going for the vaccination do not suffer from bad experience or an adverse medical event. And of course, at the same time, Singapore continues to monitor this space of adverse events very closely with other regulatory agencies, be it in the United States, UK, Europe, Japan, to make sure that any knowledge of known, unknown adverse events are quickly shared and communicated.
Now, separately, your team was commissioned by MOH to conduct a study on cases of suspected vaccine-related stroke or heart attack. Your team found that there has been no overrepresentation of these events so far. Professor, could you elaborate on the findings?
So, one of the concerns is whether some of this news that have surfaced in social media, be it locally or internationally, about how taking the COVID-19 vaccine results in life-threatening events such as strokes, heart attacks, and whether such news have any basis. And there are different ways to approach this. The first is to really think about evaluating the evidence linking the vaccine with the occurrence of such medical events. The first is, of course, mechanistic in nature, where there is the proper clinical assessment to the cause of the medical events. The other is actually looking at the epidemiological signals, meaning, do we start to see a lot more medical events happening to the people who have just received the vaccine? So my team was commissioned to look exactly at the latter, to look at the epidemiological signals. And in order to do that, we needed to understand, on average, in a single year, what is the baseline number of strokes and heart attacks that we would have seen in Singapore anyway. So for example, back in 2018, there were exactly 8,326 cases of stroke and 11,887 cases of heart attacks. Now, based on these numbers, we can look back and see how many do we expect to see in a single day, especially for people within a specific age group, such as 60 and above, since the risk of strokes and heart attacks do vary by age as well. And based on that, we can start to determine, given the number of people that have been vaccinated, how many cases of stroke and heart attacks would we expect to see by chance, meaning nothing to do with the vaccination, just within a 24-hour period post-vaccination, or within a week after vaccination, or within a month after receiving a vaccination. Now, if there is a genuine link between the vaccine and any of these major events, we will start to see a very consistent signal that much more people are experiencing these events after they have been vaccinated. And this is one of the ways that actually have been used to link the blood clots incidence occurrences with some of the other vaccines that I emphasize again. Those vaccines are not used in Singapore, but there have been an established relationship between blood clots and other vaccines. And locally, there is no evidence that we have seen more strokes or heart attacks than what we would expect, given the number of people we have been vaccinating. And this is also true worldwide, not just for the local data, that for the people vaccinated with Pfizer, Moderna vaccines, there have not really been any over-representation of strokes and heart attacks. And as I said, this is one of the ways, and the mechanistic clinical evaluation is another. By combining the insights from different approaches, this presents a very consistent picture to us that both locally as well as globally, there is no link between the vaccines that we use in Singapore and major events such as stroke and heart attacks.
Well, thank you so much, Professor, for the insights and, of course, for setting aside time to come onto the show. I've been speaking to Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS. Still on COVID-19 related news, scammers are exploiting the COVID-19 situation in India by asking for fake donations here in Singapore for the purchase of oxygen concentrator machines. The police said today that the scammers have been using hacked WhatsApp accounts belonging to friends of their targets. The scammers would emphasize the urgency of the situation and provide the victims with a bank account number for fund transfer, claiming that the bank account belongs to the supplier. Meanwhile, the COVID-19 situation in India continues to worsen with a record daily rise of over 414,000 cases today. Deaths also reached a new high at about 3,900. Australian citizens stranded in India will be able to return home from May 15th in a reversal of a controversial ban on arrivals from India. Prime Minister Scott Morrison said Australia will charter 3 repatriation flights between then and May 31st. Some 900 people deemed most vulnerable are expected to be prioritised. They will need to return a negative COVID-19 test and undertake the standard 14-day hotel quarantine. Now, a quick look at other headlines. Singapore citizens above 16 years old who apply for their passports on or after October 1st will have their passports valid for 10 years. This is up from the current 5 years. But the Immigration and Checkpoints Authority said for those below 16, the passport validity period will remain at 5 years as children's facial features change as they grow. The application fee remains unchanged at $70. According to the Land Transport Authority, the number of people injured or killed while on board lorries has fallen in the last 10 years. And this has been the case since safety measures were rolled out to protect workers in 2009 and 2010, though LTA did not give specific figures. LTA also said that Singapore is not the only country to use goods vehicles to transport people, citing countries like Canada and Thailand. This issue is back in the spotlight after 2 workers died in a road accident last month while sitting in a lorry. Parliament is expected to address the matter when it sits on Monday. Now, scanning QR codes will soon be a thing of the past. But if you want to use the Trace Together check-in system at public places before the official rollout on May 17th, well, here's a step-by-step guide.
Changes are ahead for how we safely check into public places, and some of us may need to adapt to new methods. From May 17th, visitors to venues with high footfall such as malls, offices, schools and places of worship will use one of 3 methods to check in, using either the Trace Together app or token. That means saying goodbye to scanning QR codes through your mobile phone's camera or the SingPass app. And from May 31st, you'll no longer be able to check in using your NRIC. Instead, open your Trace Together app to scan the QR code at the building entrance. Checking in can also be done by tapping your Trace Together token or app at the Safe Entry Gateway box. Here's how. Make sure to turn on Bluetooth and open the app. Bring your Trace Together app or token within 1 to 25 centimeters of the gateway box. Once you hear a beep and see the green light, you have successfully checked in. The Trace Together app also has some features designed to streamline your check-in. For places you know you'll visit on a regular basis, they can be added to your favorites list. Families will find the group check-in function especially useful. Group members can be added using their NRIC or PIN number. Then it's a simple matter of selecting them as part of your group when checking in with the app. The Trace Together app has also been updated with features to indicate your vaccination status and possible exposure to COVID-19 cases. If you have yet to collect your Trace Together token, you can pick one up at any community centre. The Smart Nation and Digital Government Office and Ministry of Health said the change is to achieve greater coverage and participation in the Trace Together program. This will also make digital contact tracing even more effective, which is especially important for venues where community spread is most likely to occur.
And those are our top stories for today. For more news and videos, visit straitstimes.com. And remember to subscribe to our YouTube channel by hitting the red button below. Once again, I'm Haryanto Diman. Have a great weekend and I'll see you next week.